This is Health Unabashed on Healthcare Now Radio, a show that spotlights and features promising health and wellness innovations in pursuit of a sustainable and equitable healthcare delivery and financing system. Hosted by digital health advocate, author, and thought leader Gil Bashe, the show looks at the thought-provoking ideas, people, and companies that are making a difference. I'm Gregg Masters, the producer and co-host of the show, and join Gil as we engage top industry talent who share their insights and best practices to create sustainable change. On today's show, our guests are Dr. Alex Jahangir and Katie Seigenthaler, co-authors of Hotspot, a doctor's diary from the pandemic. Dr. Jahangir is professor of orthopedic surgery, medicine, and health policy, serves as vice chair of orthopedic surgery, is director of the Division of Orthopaedic Trauma, and executive medical director of the Trauma Patient Care Center at Vanderbilt University Medical Center. And in his spare time, he chairs the Metro Nashville COVID-19 Task Force and is a member of the Metro Nashville Board of Health. Katie Seigenthaler is an accomplished journalist and managing partner at Finn Partners and the book's co-author. And with that introduction, Gil, over to you.
I know this is a very special segment for you, Gregg, as a public health expert. And Gregg Masters, who has a master's in public health, also has a great radio program on Healthcare Radio Now called Pop Health. I encourage everyone who's interested in this segment to visit Gregg's program. And Dr. Jahangir and Katie Seigenthaler, thank you so very much for joining us today. And we're going to dive into a book. I've had the privilege of reading the publisher's proof copies. I just want to tell everybody, you're going to tell about the book in a second. I just want to tell everyone that this is a hot book because Dr. Jahangir and Katie, who's really been instrumental in bringing this book to life, tell probably one of the most intimate stories of the evolution of a community around the COVID-19 pandemic in a most compelling way, a real way. And just to give a little bit of context here, Alex, Dr. Jahangir, is with the Vanderbilt University Medical Center. He is a trauma surgeon. He's the chair of the department there. He is very active in his community in Nashville, which is one of the great cities of the world. Katie Seigenthaler, who hails from Nashville, she comes from an illustrious family of writers, of journalists. Some people may recognize the name from the famed John Seigenthaler, Pulitzer Prize winner, USA Today, the Tennessean, the Seigenthaler Bridge. That's all part of Katie's legacy. They haven't known each other from childhood, though they live in Nashville and reside there. They've collaborated on this very important book. Dr. Jahangir has been involved in local community public health affairs for some years. He has a very special perspective, and I think an ability to empathize with patients and the community, because while he's really born and raised, so to speak, in Nashville, he arrived in Nashville from Iran when he was 6 years old. War-torn country, refugees established themselves in the city, left to go to medical school, wonderful medical credentials, and then obviously returned in, I think, 2007, if I'm not mistaken, to Nashville to make his home there. Obviously, tremendous impact. He's an advisor to the mayor on health affairs. And obviously, we all know 2.5 years ago, COVID rolls into town and our nation faces complete chaos. How do we deal with a public health crisis, an epidemic that affects us at the very fundamental household level? Dr. Jahangir had to deal with that at a different level because Nashville has a variety of different populations, and not just the people who live in their homes who are impacted, but also the homeless. And he jumps in after a number of stumbles on the public health level, steps aside somewhat from his role as an orthopedic trauma surgeon, and jumps in to support the city in the most important way possible, spreading his knowledge and abilities, mobilizing assets in the city. And this book that he's written with Katie is coming to life. I believe it's going to be available for purchase in September. And although I have a copy of the manuscript, I am probably going to try to be one of the first online to buy it by pre-ordering. And don't hesitate to do that. It's a really good book. Dr. Jahangir and Katie, thank you so much for joining us. And tell us a little bit about, first of all, the book. Dr. Jahangir, would you jump in? And then Katie, you kind of live the story as a co-author and bringing it to life. I'd love your experience as not just a writer with Dr. Jahangir, but also someone who's kind of lived it through his experience. So Dr. Jahangir, tell me about the book.
Sure. Thank you so much for having us on today. Gosh, the past 2 years has been such an experience for all of us. And I, like many, were given very unique experience that I never envisioned would happen. So what happened was I was chair of the Board of Health with the one mission of hiring a new health director to start. And I was going to step aside as chair of the Board of Health again, because as you pointed out, I'm an orthopedic trauma surgeon. And what do I have to do with public health? But the city, one of the reasons I actually decided to first serve on the Board of Health is I'm the only member of the Board of Health that actually received services from the health department when I was a kid. When we came over here from Iran, I received vaccinations, I received dental care. I mean, the health department of this city meant a great deal to me. So when I was asked to step on the Board of Health, it was a very humble honor. And then I agreed to serve as chair because we were going to hire a new director to deal with what Public Health 3.0 really has become. We hired a new director. He was coming down from New York, and he was scheduled to start on March 9th. And the first case of COVID hit Nashville on March 7th. And at this time, the mayor asked me, that's Sunday, so March 8th, to come to a press conference and really kind of do what I think a lot of us early on thought about COVID. We'll say, hey, it's going to be fine. We got it figured out, and let's go, and it'll be fine. So that was my message at my first ever press conference I even attended, much less spoke at. Then we realized very quickly that this experience of COVID was going to be really very different than what I think anyone had really realized the first week or two. And by that Friday, I was asked to lead a all-city response as chair of the coronavirus task force. And really one of my big tasks was to bring together our hospital systems. We have 3 really amazing hospital systems here. We have 2 great medical schools. We have a great private sector in this city, all of whom were working independently to develop a COVID response. And I was asked to bring that response together. And very quickly, we started realizing that, we had issues with testing, issues with our minority communities, our unhoused Nashvillians, our immigrant community. I think people don't realize 12% of Nashville is foreign born. And the mayor asked me to bring this response together. And what I would do every day, because what I did realize quickly is that, this experience was very unique. And I remember when my mother-in-law's father passed away. He's a World War II pilot out of England. She pulled out all his old letters that he had from when he was serving overseas. And I have at that time a 5, 7, and 9-year-old. And I just kept a notebook that I had every day. Would just write a little, maybe here's the number of cases, number of deaths, here's the problem we had today, and here's how we dealt with it. And every day we just start writing this. And this experience that we all went through, and I went through it not only in my public role, but also very in my private role as a father of young children, schools being out, as a new American, as somebody whose wife who was in the workforce had to come out of the workforce. All of these experiences, I hope to share with the people who read this book, because I think we all shared a version of this story, and I didn't want to be lost to history. Because what I realized 1.5 years into it, when I went back to my notebook, is I had already forgotten a lot of what I had experienced, and that's how this book came to fruition initially. And joining forces with Katie, who really helped me weave a story that we can all.
It's interesting. You haven't mentioned the name of the book, which is Hotspot, and I urge people to go out and look for it. It's Hotspot: A Doctor's Diary from the Pandemic. And Katie, you and Dr. Jahangir have done a magnificent job bringing this story to life. It does read like a diary, and yet there is something very personal about it, and there's so much to learn from it. I would recommend, this might surprise you, I'd like a reaction to it. I'd recommend almost every CEO go out and get this book, because it really is the story of fluidity and organization and vision and humility all rolled into one. Am I overstating this?
I don't think you are. I don't think you are, Gil. And I think that I would recommend that anyone who wants to remind themselves of what they endured and what they triumphed over would really enjoy it. It's a very short read, and the way that I became involved with it in the early days of January 2021 was that Alex brought this notebook to me, and as you know, Gil, our firm, Finn Partners, had helped the city communicate throughout the pandemic. And that was how Alex and I knew one another. And he said, would you just take a look at this notebook and just, is there anything here that might be worth, if only just to put it together for my family, for my children, because he, as he just described, he had this experience of reading it and thinking, oh my gosh, all of the things that happen. And I will tell you, Gil, I know you well, I know Alex well. You may be the two people able to get more done in a day than any two people who I know. So you have that in common. And I think that Alex moves so fast and gets so much done. And he took this time for reflection. And one of the things that I realized immediately was that he was encapsulating what all of us had gone through. And yet it was also a very personal experience. And what I urged him to do, because in many ways it was a doctor's diary, right? This happened, and then this is how we tried to resolve it. And it was always with him about the group that was working together. And I started asking him a lot of questions about how it had personally impacted him. And the stories that came from that, which we then began to weave into the narrative, and I'd love for him to talk about them and share some of them. The story of his daughters breaking down because they couldn't understand how one person being bitten by a bat in China had upended their entire lives and pulled them away from their friends and their grandparents. The story of him trying to buy eggs in Georgia, in a small little market in rural Georgia, and being told because he was wearing a mask and his skin was too dark, I'm not going to sell you eggs, buddy. Not happening. The story of the day that Nashville was bombed, and on top of everything else that they're dealing with, he's got to figure out if the attackers may be after him and after his family and after the mayor. I mean, these are the kinds of stories that over the course of conversations we pulled out and wove into a narrative of doing, constant doing, that I think really bring this richness of a detail and really bring him to life for readers, but also remind all of us of those moments that we'll never forget and that really encapsulate all of the trauma and all of the triumph. So I would love for Alex to bring some of those stories up, because they were what drew me in and kept me completely engaged in this project from start to finish.
And if you're just tuning in, you're listening to Health Unabashed on Healthcare Now Radio. Our guests are Dr. Alex Jahangir and Katie Seigenthaler, co-authors of Hotspot, a doctor's diary from the pandemic.
Thank you, Katie. Now, Alex, Katie has sort of given you a buffet of some of the stories in the book. There are other stories in the book as well. I learned a lot about your work and some of the work ahead of us. Your voice as a public health expert to some extent, because Nashville is a microcosm of our nation. I think it's one of the fastest growing cities in the United States, and it's a city you could say of immigration from the United States. People are flocking to Nashville because of its opportunity, and yet you have also within that great prosperity, there is also great pockets of poverty. And although Katie didn't mention this, I'm wondering if you could share some of your perspectives as a clinician, as someone who is charged with protecting the residents' health. Would you share a vignette or a thought about dealing with the communities of color in Nashville?
Yeah, I think early on, health disparities is not something that many of us in the world of healthcare are naive to, right? I think there's a reason why you have higher mortality rates, lower age of life expectancy, higher infant mortality, higher incidence of diabetes, and so forth, and people of color and people of Hispanic ethnicity, and so forth. And what very early on I realized, and I think others realized, was that what COVID was going to do was it was just going to further shine a light on the fact that health disparities are real, and this was going to impact a lot of people of color more so and more dramatically than others. And one thing we have in this city that is a shining gem is Meharry Medical College, which is a historically Black college university, started, I believe, 1876. And its leader is Dr. James Hildreth. Dr. Hildreth, amazing leader of Meharry, but beyond that, happens to be one of the world's most preeminent, well-known infectious disease doctors. I mean, led
who also wrote the foreword to your book, I might add.
Yes, that he very, very kindly did that. But he led a lot of the work on disparities in HIV. Great friends with Dr. Fauci. I've learned throughout this thing. I mean, amazing person. And early on, while again, I recognize health disparities, and being on the Board of Health for several years prior to COVID, we really started looking at what interstate system that was built in North Nashville did to that community. Why literally a child born in the same hospital as me, as my daughter, who lives 3 miles from where I live, has a 12 to 13 year difference in life to my daughter living 3 miles away. I mean, all that I was aware of, but really making an impact on that required trust. And what trauma surgery has taught me about leading in moments of crises is you have to build trust ASAP. And I do that is every day when I come across a patient who I just meet after a bad car wreck. And I knew we had to do that quickly in a moment of crisis of COVID for where our city is. And for me to build trust within communities that have historically, for right reasons, have concerns around trust, for frankly, a person who comes from for lack of a better word, an ivory tower academic medical center, I needed to make sure that the right messengers did this for me. And Dr. Hildreth in the African American community was a big messenger. Also happens to be one of the smartest people I know in this issue. So it really helped me just get much smarter on the issue and help guide our whole city. But also in the communities, the immigrant community, as I mentioned, 12% of Nashvillians are foreign born. We messed up early on. While we focused on African American community and we placed our 3 large testing centers in areas where it was much easier for people of African Americans to go to, or people who may be experiencing homelessness to go to. We even put one center in a place where there's mainly new Americans to the city. That center wasn't being used as much as the other centers. And I realized later part of that issue was we weren't doing a good job communicating. And part of the reason Finn Partners, frankly, came on board early is within the first week, I realized this is much more than a health issue. This is a communication issue. And I am by far not a public relations expert. And so bringing on Finn Partners, that helped some, but to get trust in our new Americans, it really involved partnering with church groups, with organizations who for years have helped our immigrant community. And it took, frankly, me and others, the mayor and so forth, recognizing that, hey, we don't need to be the face of this to certain communities. We don't need the credit, right? And I think that's a failure in leadership in today's society. A lot of people just want the credit. Let the people who have the trust do what needs to happen. And I think we did that. And I think if you look at in June of 21, so vaccines have been about 4 months, of the most vulnerable population, 55 years and older, within those first 4 months, 53% of African Americans over 55, 58% of whites over 55, and 85% of people of Hispanic ethnicity over 55 in our city received their doses of vaccinations. And I think that can demonstrate that only happened because we had built trust in those communities. And I think that was a great lesson for me on how to advance the public health world here. And these are initiatives, by the way, I have to add that the public health department is now continuing with childhood immunizations and WIC and other really important public health initiatives, not just COVID.
Listening to you and Katie's comments leading into this, I often use the phrase that communications is part of the care, and I reflected on your book and your comments just now, and have written about the fact that our Secretary of HHS, who she is really dedicated to doing, CDC rather, is dedicated to doing a fine job. And there's been a number of false starts there. And I think part of that is indirectly, you don't address that in your book with Katie, but part of this is what you're talking about is, the science is the science. Connecting the science to the people is communication. That's the bridge between the science and the people. You seem to have a certain sensitivity of that. Your life experience. Katie talked about three or four dramatic stories. One, all of them stood out and touched my heart in the book, and Katie reinforcing that. But the one that some I understand and they open my heart. One just disturbs me outright, which is you're attempting to buy eggs masked and kind of being refused service. It's a blatant case of discrimination at the worst form, denying sustenance, right? That's, forget about the eggs or the purchase, sort of denying sustenance on the basis of color. Here you've gone to medical school, you've lived the bulk of your life in America, and you're treated in a store, in a convenience store, as a second-class citizen. How does that change your perspective? How does that change your perspective about people and this nation?
Well, I think there's a saying Katie and I would talk about, and we write it in the book. This experience of what COVID has done for our society has really highlighted for me the real juncture that we're at as a society and as a country. Unfortunately, I think the leadership of the last administration has enabled a lot of fissures that were in our country that I think we're hopefully at least trying to get filled up, of accepting that it's okay to highlight that someone's the other and not elevate the country and help those who are new to this country. That is a problem. And there's a statement in trauma surgery that all bleeding stops, right? And so all bleeding stops, either you do the intervention and it stops bleeding, or the patient bleeds out. And I worry as a country, we're in a place where, I think the bleeding around COVID, we've kind of gotten under control. But what I worry about is the bleeding around society and this civility that we're lacking. And it gives me concern, but also makes me want to do better and help elevate that.
I hope you will. Hotspot is a great book. Katie, I wanted to ask you very quickly, what's your biggest takeaway from this book? You've kind of lived the book vicariously through Alex. And, when you're, co-authoring and you're bringing someone's words to life, that's a very precious role. What touched you the most about the book and Alex's journey?
Well, it was a tremendous honor. I think it was the moment when Alex and I discovered that the people who had been the guiding lights for him throughout this tumultuous time were all African-American leaders. And he realized this, and he realized that the reason in a lot of respects was because they had lived the kinds of experiences he lived in that convenience store for generations and for generations, and yet they've endured. And I think that's where we wound up. That's where Alex wound up, that we can lead into the unknown. We can endure. And the African-American leaders in Nashville showed him that.
Alex, one of the things that I've seen in this country is we're failing as communicators to talk about why the public has to participate in the mission to stay healthy. And your book really points that out, but it also points out points of hope. What were the moments where you felt most hopeful during the COVID journey and your role? There's
a saying in Nashville that I've seen throughout my years here. Anytime there's any kind of crisis of Nashville Strong. And this community, despite the few very loud people and not so fun experiences we've had, came together so aggressively and so quickly together. And I saw it every day, whether it was people bringing in their senior citizen neighbors to get the vaccine, or whether it's the people bringing in food and support for the people at the testing sites, or whether it's people helping educate children who may need some tutoring. This community came together, and I think people lose sight of what that meant. And the private-public partnerships that happened, sometimes organically, really allowed us to be successful. And that gives me a lot of hope, both during COVID, and gives me a lot of hope for what we can achieve in the future. And will always stay with me.
Yeah, that's a very important part of the book. It's a model for success. Katie, you've lived also a very inspired life. I know quite a bit about beyond your work with the Chicago Trib and your history as a writer, but you're an inspiring person in your own right. What inspired you about this journey?
What inspired me more than anything was Dr. Alex Jahangir. He was without a doubt one of the most selfless leaders I've ever worked with. And I've worked with a lot of tremendous leaders. And I think that Nashville was certainly lucky to have him. And I think a big part of the reason why was because he felt so lucky to be doing everything he could every day.
Alex, I want to congratulate you. First, I want to thank you for your public service. It takes a lot to add to a busy day. You're chair of a department at one of the nation's prestigious medical centers, and yet you're serving the community in this broader way. And then when COVID hits, you leap in. Hotspot, Your Story with Katie Seigenthaler is a great book. I'm thrilled that you were able to talk a little bit about it here on the program. Everyone, I think it's available for pre-order. Is that correct, Katie?
It absolutely is.
There you go, folks. Hotspot. And I want to thank you both. Alex, Katie, thank you so much for joining us today.
And that's a wrap for today's broadcast. We want to thank our listeners for tuning in, and our special guests, Dr. Alex Jahangir and Katie Seigenthaler, co-authors of Hotspot, A Doctor's Diary from the Pandemic. For more information on the book, go to www.hotspotthebook.com, and do follow Dr. Jahangir on Twitter via @AlexJahangir, and that's AlexJahangir. You can learn more about Health Unabashed on the program page at healthcarenowradio.com. Do keep the conversation going with Gil and me on Twitter by connecting with us via @Gil_Bashe, and that's BASHE, and Gregg Masters MPH, and that's Gregg with 2 G's. And do remember to tag your tweets with #HealthUnabashed. Until next time, stay unapologetically passionate about improving health.